Perfect. Good morning. So you might see in your programmes that it's Dr. Paul Hines listed, so Paul couldn't be here today. We're co-collaborators on most of our stuff, and luckily for you guys, I'm far more charismatic, so I'll be able to cover what we're talking about. I'm going to talk about climate change and health, and a bit about extreme weather impacts, and kind of posing the question, what are we waiting for? And after that terrible pun, we can kind of move into the science side of things. What I want to point out is that when we talk about climate change, and I think Conor did an exceptional job at kind of making this message clear, it's very complicated as a topic, and then when we mix it with human health, it's even more complicated. So climate change can impact human health in myriad different ways, both directly and indirectly, and a whole suite of things ranging from mortality, which obviously we want to avoid, all the way down to things like morbidity, diseases, allergens, etc. I'm going to talk in the first instance about infectious diseases, which is an area we've been working on quite a while. And just to refresh your memory, although I don't really think I need to, as Conor was saying, climate change is happening here and now. We have our global projections of what the world is going to look like in the coming years under different scenarios. And we know now, the IPCC have said it, or the IPCC, you should say, have said it, that increasing global temperatures are going to have a direct impact on the transmission and incidence of disease. And this is particularly true for environmentally associated diseases. So this is an area that we are very interested in looking at. As we know, the temperature in Ireland is going to change along with the rest of the world, and with that we will see changes in our meteorological conditions as well, from rainfall, etc. Okay, so we need to look at how this will impact diseases. And I'm an environmental scientist, not a microbiologist or anything, but I'll just say from the get-go, I think if we want to talk about climate change, I suppose the lens of health is a really good one to look at it at, because people are selfish and people generally care about human health and well-being. So if we frame it under this auspice, it's quite effective in enacting change. So I'm going to be talking about two pathogens. Okay, one is called VTEC. I don't know if you've heard of it before. It's a pathogenic strain of E. coli, which you've probably heard of. And I'm going to talk about cryptosporidiosis, or cryptosporidium. If anybody is from Galway, they might be perhaps too familiar with that from a big outbreak back in 2007. But these diseases are interesting in the Irish context because we have the highest incidence rate of them in Europe. Okay, even if we bring the UK back into the EU, we have a much higher incidence rate than the UK as well, for countries that are quite similar. Right, it's one of the few things we lead at in Europe, is having the highest level of these infectious diseases. They are both associated largely with waterborne exposure. VTEC is foodborne as well, but cryptosporidiosis is primarily waterborne. So if we can look at these diseases, we can look at them relative to different climatic conditions and get a picture as to what's happening now and into the future. Okay, so we've been looking at these diseases for a long time, most of my adult life it feels now at this stage, and we know certain things already. So climate change aside, we know that as rainfall increases, for example, we see an uptick in cases of VTEC infections in our health records. We also know that flooding causes an increase in outbreak of diseases, and these two maps here are from that big flooding events in 2015 and 2016, if you remember, where a lot of the Shannon Basin flooded, and we were able to see in response to that large disease outbreaks in both VTEC and cryptosporidium that kind of mimicked, I suppose, the geography of the Shannon Basin. Okay, so we know that meteorology drives infection in Ireland, primarily through a kind of complicated mechanism of drinking water. And Michelle gave a nod there that I talk about groundwater quite a lot. I'm not going to talk about it too much today, but private well utilisation in Ireland is one of the key drivers of these infections. If you use a private well in Ireland, you're almost 20 times more likely to get a VTEC infection than if you're on the public supply. With crypto, the public supply can be overwhelmed by heavy rainfall events, etc., that leads to outbreaks of disease, as we did see in Galway in 2007. So it stands to reason that if any changes in meteorology occur, this will then impact the disease records as well. Okay, so we decided to look at that seriously in a project funded by the Environmental Protection Agency called Crisis. And we took infection data from the HSE, from the Health Protection Surveillance Centre. So this is actual cases that happened, real-life people, and we mapped them to the census small areas. Okay, there's nearly 19,000 of them. Right, you see that we have a lot of cases, as I was saying, of the diseases, so we have a nice bit of data to kind of work with. And what we wanted to see is putting numbers, I suppose, on the relationship, in particular, of temperature and rainfall and these diseases, and then using the models that have been created, largely through Icarus and Maynooth, etc., to see what this looks like in the future. So what will these diseases look like in terms of climate change predictions for Ireland? I'm not going to get bogged down on this, but I am a scientist, so I have to have some sort of methodology kind of shown. We did space-time clustering analysis and different kind of statistical modelling techniques to achieve all this. Don't really need to get too much into it, just that they are kind of accredited methods of looking at things. And just to kind of show you as it stands, this is what VTEC and cryptosporidiosis look like in Ireland as it stands. And what I want you to take away from this actually is that these are not urban diseases. Okay, so population density is not a driver of these diseases. In fact, it's the reverse situation. They're rural diseases which kind of mimic the water kind of infrastructure in rural Ireland. If you think about the kind of Shannon Basin and things like that, you'll see that a lot of them are kind of centred around it, right? Where we have kind of different soil types and different hydrological conditions, we see kind of different spreads in the diseases. Okay, so we know now kind of the areas in Ireland that are more susceptible to different disease outbreaks, and from that then we can kind of map what it looks like going forward. Okay, so we did what's called Monte Carlo simulations, where we looked at what these diseases look like if we altered the precipitation events or the temperature, etc. And if we look at cryptosporidium here in particular, we're seeing that with a 20 millimetre increase in rainfall, we're getting an upsurge of 127% of cases. Similar story for VTEC, it is increasing as well, showing that as Ireland, and Ireland maybe won't get wetter overall, but as we have kind of more extreme kind of rainfall events, we will see increases in these diseases. And again, like remember, that's people getting sick, that's potentially hospital stays, that's an economic cost in terms of hospitalisation, days off work, okay, real kind of social kind of issues. Similarly, if we look at temperature changes, we see a similar scenario. And with temperature, when you're talking about bacteria, you get kind of an increase in bacterial growth, different kind of factors at play here. We see that VTEC cases are going to increase by 219% under a 2-degree temperature rise scenario. Right, so a huge burden of disease will be recognised under a changing climate in this country, and again, not as high, but fairly high, 169% for things like cryptosporidium. Okay, to show you what that looks like in terms of the distribution, right, and looking forward, the control here is in the middle. This is for rainfall in VTEC. You can see it kind of mirrors the first map that I showed you. And you see if we go up to 40 millimetres of rainfall there, the majority of small areas in the country will now have a case of this infection. Okay, in children in particular, it's a very dangerous infection. It can lead to kidney failure, hospitalisation, in very worst case scenarios, even death. Right, so a very kind of causal link between a change in our climate and a direct impact on human health. But that physical health things are obviously problematic. We don't want people getting sick, but there's more to look at as well. And I'm really glad that Conor kind of mentioned it in his opening talk, because what isn't talked about enough is the mental kind of well-being impacts of all these as well. So as part of the same project, and this is a stopgap tour of this kind of research, we did a national survey to see if people had experienced extreme weather events and what was the psychological impact of being exposed to them. It's no surprise that in terms of extreme weather in Ireland, the main things people are dealing with are storms, flooding, coastal surges, etc. Okay, we do have a big problem with water. That has historically been true with or without climate change, but as Conor alluded, that's not going to get any better over time, it's going to get worse. So we asked the people who had experienced an extreme weather event a series of questions, and we were then able to calculate a psychological well-being score. And this score is developed by psychologists, okay, it's not something that I pulled out of thin air, measures the likelihood of experiencing post-traumatic stress disorder. It's something that you'd administer to soldiers after war to kind of assess their well-being thereafter. Going into this, I was uncertain if we'd kind of see anything, but what we did see is, just to explain this a tiny bit, if you have a score of 32 or above, you're at a clinically diagnostic level to be diagnosed with post-traumatic stress disorder. And as you can get a bit of a taste from the responses here that have been graphed, we had a lot of people above that level. Okay, so we actually had a mean score that was above that clinically diagnostic level. So people who experienced extreme weather events were traumatized by the fact they had done so. Okay, and then when you look at photos of like the Indus River bursting in Pakistan and the devastation of that, you might think that the flood in Middleton like pales in comparison, but it's all relative. Like it's all kind of economies of scale don't really matter. If your home has flooded or things like that, it is going to impact you. And what we saw in particular is if people's health had been impacted by the floods, if their property had been damaged, if their finances have been damaged, those all exasperated the likelihood of them having post-traumatic stress disorder. Okay, so just the take-home messages from this is that climate change in Ireland will inevitably lead to poorer health outcomes in this country if we're not kind of going to tackle things, and they'll largely be driven by hydrology. So it's hydrology that's the key factor at play here. Environmentally associated diseases are going to increase in both the incidence and the geographic distribution. Okay, so we can't even kind of place bets on this only happening in some regions. It's going to spread. And then aside from the physical health, there's a looming and kind of often ignored kind of psychological impact to this as well that really can't be ignored any longer. And it's probably a much more difficult problem to solve that's definitely worthy of further investigation. We urgently need actionable policy, I think, that you can actually is tangible and real to help protect those most vulnerable through whatever kind of means we need to do it, and reduce the environmental, social and economic burden that this is going to have. Okay, to sum it up in kind of a sentence, climate change is a kaleidoscope issue. Right? Can no longer be viewed through an environmental lens, I think. It has to be viewed as a very kind of broad lens. Okay, it's a global problem with extremely local consequences that we just need to keep chipping away on as much as we can and try, I suppose, adapt and mitigate against any kind of further deterioration in the future. Okay, so I'll be here for the rest of the morning and I'll be sitting on the panel if you have any questions. Thanks.